House District 46 here in Pueblo, also chair of Joint Budget Committee for the General Assembly. Thank you for being here today. The first thing I want to get to, I think that this is different for you because it's personal for everybody, but for you it especially hits home with your wife Heather, who works in healthcare and is a nurse. So can you talk a little bit about what that's like when a spouse goes to work every day, is in danger, and could bring it home? What is that like for her and for you?
I think the first word that comes to mind is overwhelming. Um, Heather absolutely loves her job, loves being a nurse, and she works with some vulnerable um, patients. You know, she works at a cardiology office and runs a heart failure clinic, and some of these patients are some of the ones that are easily could be impacted if they were to get COVID. And so that's nerve wracking in of itself, but also, you know, I empathize with any of these families. I serve with Representative Mollica, who's also an ER nurse, and during our recess, he's actually going back to work, and he was sharing me the stories that he has. He has two young kids at home, and he's having to literally debate if he's going to sleep in the garage while he's doing this or what he's going to do to keep his kids safe. I think I think healthcare workers have always been heroes, but if anything, really seeing the day-to-day jobs they do and how they put themselves out in front of their needs, they worry about other people before they worry about themselves. And as a spouse of one of those workers, it's hard, you know, because I absolutely know this is her passion. This is what she wants to do. She wants to go and help people every single day. But selfishly, I get a little worried and I get nervous that something's going to happen to her. So I'm just doing my best to follow the guidelines, and I'm trying to stay home as much as I possibly can to keep our house safe so she doesn't become impacted and pass that along unexpectedly to any vulnerable populations that she works with on a daily basis. So it is personal for everyone, but I think when you have a healthcare worker involved in your household, it becomes even more stringent. More hairs on the back of your neck stand up when you think about every little move you make coming in and out of your house.
How is she? Obviously, that healthcare workers, they know that this is their job, and they do it valiantly, and they choose the line of work, and it's
Right,
dangerous every day.
right.
Um, but how is she doing, and how does she not bring this one home? I mean, not in terms of the disease, or
Yeah,
but the stress. How can you leave that at the door this time?
I don't think you do. I mean, I think the amount of anxiety and stress that we all feel just in the middle of this pandemic, healthcare workers are carrying that burden even more so, and they're holding that and trying to figure out what to do with that. And I just she's doing great at talking about the stress of it all. She's constantly looking up information, and we're talking about it. um, it has become part of our day-to-day conversations. We don't just act like it's not happening. We talk about it, and we talk about the latest research, and we talk about how can we encourage other people to take this more seriously. How can we encourage others to pay attention to what's happening. Yeah, I I think one of the important things I'm starting to realize, and not necessarily within my household, but with healthcare workers I've chatted with, is they are the heroes, and they know they're the heroes, but they necessarily don't want to be known as heroes. They want to help people, but they also want people to start helping themselves and really pay attention and start helping the community and stay home and listen to the guidelines.
How should we reevaluate? And I know that you've worked on this, being elected in this as uh, in the state representative. But how do we reevaluate their position and stature to reward them for and honor them for what they've done through this, beyond just giving them a paycheck? Um,
Sure.
but it seems that, and I'm not whether it's a thank you party. This goes beyond it. I mean that what they've done across, and you've got reports from Denver Springs, El Paso County, Pueblo, and even in rural places across the state, that uh, a lot of this, they are saving lives. They're
Mm-hmm.
there without a lot of supplies in some cases. Um, how do we reevaluate what this industry does for Colorado when it seems that uh, they constantly struggle, whether that's paychecks, whether that's being valued by the healthcare industry, whether that's just churn and burn as nurses do often go through? Um, how do we reevaluate that and start to value this industry better, and so they're it's not just seen as, oh well, it's just someone I'm going to go see a doctor, or this person helped me out while I was in intensive care. Something deeper, something more meaningful.
I think we listen to them. One of my big frustrations a lot of times, specifically when we're talking about legislation at the state capitol, is when legislators or, you know, the higher ups of any company want to come in and tell us what kind of laws we should make that impact the frontline workers every single day without hearing from those frontline workers. We need to make sure we are hearing them and listening to them and finding out what their needs truly are. And it's not just doctors and nurses, especially if there's one thing I've learned about this entire COVID issue, it's doctors and nurses are doing great things every single day, but so are respiratory therapists, so are CNAs, who, by the way, still get paid minimum wage most times. There's a lot of people involved in healthcare, home healthcare workers. Let's talk about them for a second. They're helping to keep people, vulnerable populations, out of the hospital during a pandemic, yet they can only make about minimum wage at this point. We need to really listen to these people who are working every single day to keep people healthy, to keep people alive, and hear their needs and figure out what we need to change to make sure that they are getting what they need. I've heard stories, not necessarily Pueblo, but I've heard stories before, and it could be happening in Pueblo, I'm not sure, of nurses having to work shifts without lunch breaks, to working 12 hours and being so busy and having to take care of so many patients that they don't have the opportunity to take a lunch break. Or a lot of times they will have come home and realized they hadn't had a bathroom break all day because they were going so much. We also need to make it a profession that people want to get involved in. We hear all of the time about the nursing shortage. We hear all the time about the shortages in healthcare. How can we help grow that? And is that more conversations around higher education issues? How do we get more people involved in going into these careers? And then once they're there, valuing them and valuing their voice and their experiences and really saying, I hear you, let's make it better.
On that, and what can you do and what can you advocate for when you go back into session? Do, can you make these changes? Do you think that the legislature might see how valuable these people are, or we get out of this session putting it together with glue and sticks, and then we come into 2021 and all this is forgotten?
I don't think all this is going to be forgotten ever. And I will tell you the experience I've had in the last 6 years at the legislature. Anytime we talk about nurses or anybody in the healthcare profession, they are highly regarded. So I want to put that out there. Every legislator I've ever met puts nurses and CNAs and everybody who works in the healthcare industry up on a shelf. I just want to make sure that when policy ideas come forward, that their voices are a part of those conversations, helping us base our decisions. As far as this specific legislative year, if there's any kind of a new proposal, I think we're going to have to examine that. I mean, we're still trying to figure out today what a legislative session's even going to look like, if we're even going to have time, I don't know if we're going to have the possibility of introducing a whole lot of new legislation unless it is absolutely urgent to the pandemic that we are in the middle of. But I want to emphasize that, like, I think that we have to be sure that when we are getting ready to bring any kind of legislation forward or vote on any legislation that's in front of us, that we have heard the voices of the people that it's going to actually impact. And that should go across the board. Let me be frank. That should always be a part of the conversation. I, as a legislator, try to do that. I try to reach out to someone that's going to impact. But I think we need to make sure, especially given the heroic efforts that the medical professionals are doing right now, that is never forgotten. And I don't think it will be.
Moving into what the state response is, do you think that Colorado was prepared for this? And I'm not asking in the sense of whether Jared Polis acted quickly or anything like that. I think we knew about, or the reports came out of China, and then in early January there was it was starting to bubble up. Was this the best possible outcome that Pueblo could expect, or could more could be done early on?
I think there's always hindsight, and in hindsight, absolutely, there's more that could be done, right? I think I do applaud the governor on the amount of work he has done on the front end of this, and how much he has really put on the line and stepped forward and asked of Coloradans. I'm hoping that we see the fruits of that labor. There are still states that aren't doing anything. Let's be very clear about that. What he could have done instead, I'm not in his office every single day. I don't know what information he was given when. I do know that he is consulting with a great team of people, including healthcare professionals and medical experts, every single day to help figure out how we flatten that curve in Colorado. I do know he's an entrepreneur. He understands what this is going to mean to the economy. He's trying to balance all of that, but he's flat out said before his number one concern, and I applaud him for this, even being the chair of the Joint Budget Committee, is public health and making sure that we are protecting our people. That's super important. Now, you asked specifically about Pueblo, and I will tell you, I've been vocal about my frustrations about the original lack of testing in Pueblo. We still have a lack of testing, let me be clear on that. But when I heard that we weren't getting adequate numbers of testing to even see what the temperature was in Pueblo, that's when I was able to contact the Colorado Department of Public Health and really push them and say, what are we doing in these other areas? And not just Pueblo, let's be clear. There are areas that still don't have testing going on, and that's not okay either. So pushing really hard to say, how can we help these other areas that don't have the resources that maybe a Denver does, because they have so many different entities in that area. And that was heard. I got a response within a few days that, hey, we called the National Guard. They're going to come and set up 100 tests at the state fair. Is that enough? Absolutely not. That was a one-day sample, 100 tests. Then we had to wait forever for the pending results. That was frustrating to me too. But I learned when I called, it wasn't just Pueblo who was waiting for these test results. That it was actually the health department, the state health department, waiting for the serum in order to process these tests. Well, then when I called commercial labs, they too were waiting on the same serum. So I don't think the state has been lagging. I am incredibly frustrated with the federal government and the lack of preparedness, the lack of transparency to get everything out to the states that need to be distributed in time, in a timely manner to help people. That's what I've been frustrated with.
Well, I don't. I think that no serious person questions shutting it all down for safety reasons. Um, there was some editorials that you probably seen about a week or two ago, and even that sort of play of keep it open, let some people die so we can keep the economy open, and then that slowly was just crazy talk and disappeared. But it does bring up two issues on this. One is the personal impact, and then the other is the economic impact. But I wanted to go to the personal impact first. A lot of families in my social media feed in the last 2 days, I've seen a death from a business acquaintance. I've seen a school friend's mom successfully come out of the ICU. Somebody I cared about deeply couldn't get a test, has been quarantined for 30 days and hasn't seen their parents or children. Um, what do we say to those people whose families have been so impacted? Some gratefully will survive this, but other families, as you know, maybe their grandparent or parent passes away and they can't be in the hospital for them. Um, the personal toll. What do we tell those families now that have lost so much, and um, all because it seems that we weren't prepared? Blame whoever you want, but we were not prepared on the front end.
Nothing we can say is ever going to take away the excruciating pain of losing someone to this. Nothing we can do is ever going to bring those people back. Um, the best thing I can put out there is that we have learned from this. And when I say we, it's the collective we. It's the community looking out for each other, the community looking out for your neighbors, for your family members. It's the government, making sure that we do everything we possibly can to get resources to the communities in a time of emergency. It's the state government, it's the city government, it's the county government, it's the federal government. There are enormous things that we need to learn from in this, and that we will learn from that and move forward and be better people collectively because of what all we're going through and the losses that we have had to share.
On the economic side of it, again, when the governor shut it all down, there's going to be a lot of businesses that will be hit hard. They're either dipping into savings right now, some don't have the savings and they're just burning through whatever they can. And there's also a lot of people, as you know, in Pueblo, standing in food lines more than we've ever seen. This is not just unique to Pueblo, it's all across the country. Right. Businesses and those on the fringes, what do you do as a state representative to support those people? Because in a way, the state said we have to shut it down for safety. Everybody's doing their part as best they can. But then when we come back out of it, a lot of these small businesses have to go out and fend for themselves on the free market and say, well, I'm going to have to get a loan or try to make it, hopefully my customers come back. What can you do, either as Joint Budget Committee chair or the state representative, to get people whole again when things start to return normally?
So far what I've done is been able to share as much as possible the information that's available from the federal government. And although it not be perfect by any means, the PPP loans that are available for small businesses that are able to keep their employees on payroll and off of unemployment, being there for the workers of the small businesses who weren't able to get those loans, who are on unemployment, working really hard with the governor and working with my legislative colleagues to figure out what slipped through the cracks, what was offered on the federal level that isn't getting to our constituents and our small business owners, and what do we need to do to try to figure out how to supplement that and help get them back on their feet. I don't think I I'm not speaking out of turn when I say the entire legislature knows small business owners. Every single member knows a small business owner personally in their area, and they want nothing but to figure out how we help them. That being said, we are walking into a budget this year where we are faced with anywhere between 1.5 and over 2.5 billion dollars in cuts we're going to have to make. And part of that is the loss of revenue that's coming in from these businesses who have had to shut down. Um, we have a lot to figure out on the budget angle of all of this, but I guarantee you that we are going to be having these conversations about how do we help these small businesses come back, because we know that they are the backbone of our economy. They are who employ our friends and family. They're the part of the community that keeps the community going. And we can't forget that. And I don't think that's lost on any single one of us. I just don't know that we have the perfect solution ready to go right now. We are operating, I mean, let me remind you all, we're not even in session right now. We are all working on our own independent time at our homes, trying to figure this all out as we go. We're not collectively having hardcore conversations about policy yet. And I can't wait to know when that time is.
You said there's going to be some hard decisions that have to be made, and I think even Mayor of Pueblo, Nick Grashar, said that too, and some others have said that. So my final question is to you: how bad are you thinking that this is going to be in hard decisions? I mean, realistically, because I'll preface this by saying everybody's doing their part as best they can, but the state, this is a state order. This is not voluntary for many people. This is a state order. And the state, does help out with unemployment stuff. There's some grants, there's some loans. But the state's also responsible for a lot of people not going into work. And then the state's also responsible for not having that money to assist those people later on because they can't go into work. It's sort of a catch-22 here.
Sure.
So can you give us a perspective? How bad is it going to be? Or do you think that with governor and a General Assembly motivated to do this, that there you can mitigate the losses if we think about this creatively and innovatively and really do something more than the General Assembly going into session, doing their partisan bickering, trying to get talking points on Twitter out? Because there is not one county in this state of the 64 counties that won't be impacted. And something has to be different about when you get back into session. And I know I'm putting words in your mouth, but it doesn't seem to be that there's another way to get through this time for the families that were impacted or the small businesses that were impacted. So how do you not make this bad for people?
Sure. So first of all, I think that there's a number of legislators who do more than try to get talking points on Twitter. I want to be completely blunt about that. There's a lot of really hardworking legislators who collectively go every single day and try to make their community better. I just want to make sure I point that out. But also, my job is going to be really, really hard. We are faced with enormous cuts that we're going to have to make into a budget that we don't want to have to make. We are being faced with ideas that had come through the General Assembly that we may have really liked, but if it costs money and it's a new program, it may not happen this year. We're going to have to make these very tough decisions to make sure we're keeping the state going and keeping the state functioning. That being said, we are also evaluating money that's coming in from the federal government specifically for issues around COVID. Any kind of loss that we've had because of COVID, we are looking at the federal money that is coming to the state and figuring out how we allocate that money and appropriate that money in the most effective way possible to make people whole, to bring people back. We understand, and it's not lost on us, the levity of what's happening in our communities. Will the state be able to backfill all that? I don't know. We're looking at what's coming in from the federal government, allocating that money, figuring out what holes are left after that, and what we have left in our state budget left to be able to allocate to those other needs. I mean, I want to remind people that we're one of the few states in the nation that have to have a balanced budget every year. So we can't go into a deficit to help local people. We have to balance a budget every single year. That's in our Constitution. What's also in our Constitution is Tabor. We have to make sure that we have all of these restrictions placed upon our budget, that we are stretching our dollars every single possible way we can to help our communities. And I have to tell you, the other 5 legislators I work with on the Joint Budget Committee, we share that collective thought. And we want to do nothing but help Colorado come back from this even stronger than ever. And that absolutely includes workers that have been displaced, small business owners who are struggling, healthcare workers that need more protections, people on the front line. I mean, we talk about the frontline workers constantly in this whole narrative. Most of those frontline workers that are essential employees right now, helping keep our communities going, are still getting paid minimum wage, if that. We have to consider all of these things and come back even a bigger, better, united, independent state than we've ever been. And Colorado's known for that. And do I have all of the answers right now? No, absolutely not. Again, I'm working from home in Pueblo in a recess of a General Assembly right now, trying to put my thoughts together and gathering as much information as I can to build a budget that, yeah, it's going to hurt a little bit because it's up to a $2 billion cut. That's going to hurt somewhere, somehow. But also really talking to our federal delegation, talking to economic experts to figure out what is coming down from the federal government and how can we best allocate those funds. And those are conversations we're having along with the governor. And I hate saying this because I know people want answers, but stay tuned. We are in that process, and I'm hoping within the next month, we'll know more of exactly what the lay of the land is going to be. But know that as a representative of my hometown, there is nothing more I want to do than make sure communities like Pueblo are made whole again.
On that note, I appreciate your time with us today and trying to help.
Absolutely.
Us with this. I stay safe. All the best wishes to your wife, Heather. She stays safe too, and her patients and everybody there. And when you can get back, would you come back and let us know how that goes? Because
absolutely,
in a couple of weeks. So stay safe out there, and I appreciate you coming on.
No, thank you for doing this, and thanks for all of the reporting you all have been doing on the entire COVID issue here in Pueblo. I really appreciate your advocacy for Pueblo.
Thank you. Appreciate that as well.
Absolutely.